Welcome to the public briefing, April 3rd, for the COVID-19 virus. My name is Brian Beam, Parish Administrator for the Calcasieu Parish Police Jury. It's been a while since we've had a public briefing, and because the weekend's upon us, we wanted to get one in today and give everybody an update on all the different aspects of the response to this. So we'll hear from a few speakers. Let me mention a couple of one housekeeping item. For the sign interpreter, we don't have one today. Please, though, know that we will have closed captioning once this is no longer live. It'll be available immediately afterwards on our Facebook page on the Police Jury's Facebook site. We're going to start off today with Dick Grimion, Director of the Office of Emergency Preparedness.
Thank you, Brian. As you know, we've been conducting COVID testing out at the Burton Complex 1 day last week and 3 days this week. And I'd like to give you the totals. We had 267 cars came for the testing. 86 of those cars did not qualify. We tested a total of 209 people, and 26 of those were what we call self-pay. So our goal was about 80 per day, so we were a little disappointed that we didn't get more people to come out, but we will be doing testing again next week at the same schedule, which will be Tuesday, Wednesday, and Thursday, a.m. to 3:30 p.m. And the criteria are pretty widely available in the press. The main thing you would have to have is a fever of over 100.4. There are a couple other criteria that we will put on our website that you can review after this broadcast. I just have a couple of preparedness issues I'd like to talk about. Number one is washing our hands. We have heard this over and over, but this is the simplest and cheapest thing we can do to protect us from this. Cover your mouth if you have to sneeze or cough. Your elbow is a preferred method. And then last but not least, and I'm sure some of those speakers are going to address this as well, social distancing. It is now more important than ever. We're getting reports that this is going to be, we'll have increasing numbers of people with the COVID, and that social distancing becomes more important every day. So our advice from a preparedness standpoint, if you don't need to go out, don't. And with that, I'll turn it back over to Brian.
Thank you, Dick. And to show that we aren't just asking people to do it, we're demonstrating it. Today, for the first time, we have speakers who are not only here, but remotely using software. And our first one that's a remote speaker is Dr. Lacey Cavanaugh, Director of Region 5 Public Health. So at this time, I'm going to ask her to go through her report. Thank you.
Hi, good afternoon, everybody. Wanted to provide a few brief updates. One thing I'm going to do is I'm going to go ahead and go through all of the current numbers. But what I'd like to remind people of is that the numbers that we are seeing today are not reflective of what's actually happening on the ground in our community. Once someone is exposed to the virus, it can take up to a week before they develop symptoms. And once they develop symptoms, it could take another week before testing comes back. And then once that testing is resulted, there could be a couple of more days before it gets reported and cataloged to the parish that that person actually lives in. And so the numbers that we see today are actually reflective of what was happening in our community 2 to 2.5 weeks ago. So I'd like to make sure that everybody keeps that in mind. Of course, we are seeing increased numbers across not only the region, but the entire state. And part of that is also because we're ramping up our testing. The more people we test, the more COVID that we are going to find across the community. But it is still really good to know how many people are infected and who is infected, but then also to really keep track of how many of those people become hospitalized or critically ill. So as a state, as Louisiana, we are up today to 10,297 cases of COVID. We have 370 deaths. Over 1,700 people across our state are hospitalized, and about 500, a little over 500 are on ventilators. All of that information is available on the LDH website, ldh.la.gov. And just to show how much testing has ramped up, we have between the state lab and private labs, Quest and LabCorp, now we have done over 50,000 tests as a state that have been reported back. And we know that there are many more thousands that are pending from the past week. And so testing has definitely ramped up. And that is one of the reasons that we see large jumps in the numbers. So for example, yesterday, we saw the biggest jump we had ever seen in the total number of COVID cases across the state. But part of that is because we started to really get a lot of these private lab tests for well people that went through a point of testing site or a drive-through or got tested at ambulatory clinic. And as we get more of those tests back, of course, we're going to find disease. The main thing that we're worried about is, of course, the capacity of our healthcare system. And so the numbers of people who were hospitalized yesterday and the day before did not jump nearly as substantially as the number of new overall COVID tests that came back positive. So that means that this is not new cases that we're finding. This is just that we're now testing more people. Those people had COVID already, and we just now are getting the testing back. And so the fact that the hospital numbers did not jump up quite as much as with the overall testing numbers jumped up means that more than likely we're picking up more mild cases of disease. So for our regional numbers, Calcasieu today has 119 cases reported. We have one death that is reported on the website, but we are aware of another that is currently being investigated. So we suspect that tomorrow, if we can gather all the information that we need, that our website may show two. We've done over 2,000 tests in Calcasieu. Beauregard has 13, Allen 34 cases with 3 confirmed deaths, but we are aware of another potential 2 that are once again still gathering information and being cataloged. And in Jeff Davis, we have a confirmed 14. Few new features of the LDH website that you can now track. One is that the deaths and cases by age group are now on there. You can also now track the number of hospital beds, the number of ICU beds, and the number of ventilators. And you can track that by region of the state. So if anyone's wondering, we are Region 5 in Southwest Louisiana. And so all of those occupied beds and vents and ones that are available for use can all be actually seen. That information will be updated every day, the same way that the case counts are updated every day. That information is gathered by what our hospitals report. We are also continuing to see increasing numbers of cases in long-term care facilities and nursing homes. The last report I saw, which I think was yesterday, was that there were 47 long-term care facilities across the state that are impacted. We do have some that are impacted here within our region, and we are working very closely with those organizations and facilities to make sure that they have all the guidance they need to make sure they're preventing infection. So our infection control team is in contact with all of those facilities that we are aware of. We are also starting to see a clearer picture of who is at most risk for severe disease. We are tracking all of the deaths within Louisiana. Right now, the biggest risk factor that we have pulled from that data is that diabetes is the #1 risk factor. It is in 40% of the cases that have passed away within Louisiana. We also have 25% of the cases that report a history of obesity, 23% with chronic kidney disease, 21% with some sort of heart problem or cardiac disease, and 12% that had lung disease. Although most of the deaths have been associated with chronic conditions and those comorbidities, about 3% of our deaths within Louisiana have been in people who reported no other previous underlying medical history. So we are updating that data as information comes in every couple of days, as well as we get new data from all of the cases that have passed away. So we are definitely learning more about who this affects as time goes on. A few other things I'd like to mention that are big updates this week, one of which is that there were some new studies that were done in other countries and here within the United States that have suggested that some pre-symptomatic and asymptomatic transmission is occurring. So pre-symptomatic is someone who is exposed, who has not yet developed symptoms, but will develop symptoms. We are learning that those people could potentially be contagious up to a couple of days before they start showing symptoms. Asymptomatic people are people who never develop any symptoms of COVID, but they've been exposed, and they also can test positive and potentially transmit the disease. We still don't know to what degree those cases are contributing to the ongoing transmission. We know that more transmission happens in people who are coughing and sneezing, because that definitely spreads the virus. People who don't have symptoms don't tend to cough and sneeze. So we think that that is contributing. We don't know to what extent yet, but we definitely think that it's not contributing as much as people who are actively showing symptoms. But that brings up a very good point as to why social distancing is so important. We can't just say, if you're sick, stay home, because if that was the case, then we wouldn't be seeing asymptomatic and pre-symptomatic transmission. So you got to pretty much assume at this point that any human that you come into contact with could potentially have COVID. And so that is why we are really pushing this strategy of staying away from other people, even if they're not sick, because they could still be a carrier and you could potentially still get COVID in that manner. So also like to say that our hospitals and healthcare providers are working very hard on planning for what happens if it gets more widespread in this community. They are working on ways to increase their capacity on the local level. We've been working closely with lots of different hospitals and facilities within the region, and I'm very confident in their ability to respond to this crisis. So that is all I have for the moment, and happy to answer questions. Don't forget that 211 is a great source of information. It's updated daily. It has testing site locations, because there are many of those across our community, and they have daily updated FAQs with answers to almost any question you could possibly have. And that's all I have for right now.
Okay, thank you, Dr. Kavanaugh. That was very helpful. Let me mention before we may take any questions, Dr. Kavanaugh
alluded to the group of medical providers they've been working with. It's actually a formalized group. If you ever hear the term or phrase ESF8, that is a federal emergency response declaration number we have. It's for medical and healthcare, and on a frequent basis every week, Dr. Kavanaugh, the medical providers, we actually have an assigned ESF8 staffer, are talking about these getting hospital numbers, everything that people are asking about, and you can feel very confident that that's being looked at closely by the right people. So the information is directly from them. So I just want to point that out. At this point, any questions for Dr. Kavanaugh, which I'll have to repeat because of our setup today?
A viewer is asking whether the information about numbers of patients, numbers in ICU, and numbers on vents can be provided on a per hospital basis to assist people who are having to make healthcare decisions as to where to bring a family member.
Okay, I'll repeat the question. If I miss it, Teresa, let me know. She's asking Dr. Kavanaugh if the numbers of patients in our area, those who are on ventilators or ICU, can be broken down by the hospital provider where these patients are, for the purpose of, Teresa?
Assisting people who are trying to make healthcare decisions.
Assisting people who are trying to make healthcare decisions.
I'll tell you that all of our hospitals right now have plenty of capacity. So we're not at this point within our community that people should have to seek care at an alternate facility because one is full. We are not releasing information about specific numbers within each hospital or even within each region at this point in time. Of course, as time has gone on, we have released more and more information on an as needed basis. And so if it gets to the point that those pieces of information are critical for decision making within the community, then I'm sure that information will be shared. But right now, it's just not necessary.
Okay, what is the lag time again for testing in Calcasieu Parish, and are any of the local labs being allowed to do the analytical work yet?
Okay, the question is, please restate what the estimate of the time it takes or lag time between the collection of a sample and the actual test result. And and are there local labs that what?
That are doing the analytical work. Last time we were told they were in Dallas.
Okay, yeah, I think that's in Dallas, but where is the testing? And I'll let Dr. Kavanaugh answer both of those.
Right. So right now, all testing is still having to go to Dallas. So it is a reference lab that is completing those. We are trying very hard to figure out how to bring some of those rapid tests that you're hearing about in other regions to Southwest Louisiana, but you have to imagine that it's very challenging because the entire country wants to get those companies that can provide that service on site. And so it is going to the places that have the highest need. Even New Orleans and Baton Rouge and Shreveport that are getting that technology are still limited with the number of samples they can run with that rapid 45-minute turnaround time. I think that as time goes on, those supply chains are going to increase. But right now, we are attempting to try to bring that technology locally, but there are not enough resources for us to be able to secure that right now. But definitely, I think that'll be a game changer because as we are able to do testing in more real time and get answers a lot quicker, that will help us to make decisions.
Well, how could you be getting any of the rapid tests, and are the local hospitals using chloroquine? Yes.
Okay, the first question, will Calcasieu be getting any rapid tests? I think she answered that one, Teresa, by saying there are a limited number of those in the higher demand areas across the country are currently doing it, but we are clearly, that's something in the works to where areas like ours, once we get those, can make a big difference, and it's being pursued vigorously. You're gonna have to.
A viewer wanted to know if any of our hospitals are using chloroquine as treatment.
Chloroquine?
I don't know what that is.
Dr. Kavanaugh.
I can speak to that.
You heard that? Thank you.
I sort of heard it. So asking about drug treatments, right? There are a lot of reports coming out on the national level of azithromycin and hydroxychloroquine, and there are some antivirals that are being investigated to see if they're effective against COVID. And the preliminary studies are very promising. And so we are very hopeful that those medicines will eventually be able to be used. They're being investigated in two worlds. One is someone is critically ill, and two is What about for prevention? Could we use any of these drugs in, say, healthcare workers to prevent them from getting ill? And unfortunately, the data is still very preliminary. There are some physicians who are probably already using these medicines, even here locally or on a national level. But the data is still so preliminary that it's not considered best practice yet. I think that in the next week to 2 to 3 weeks, as they're already doing trials, drug trials on these medicines, I think we'll have a lot more information. So I'm very hopeful that these could be helpful, but I just don't think that there's enough data yet to say for sure that they will be.
Should people start wearing masks when they go out yet?
Should people start wearing masks when they go out is the question.
You know, we're still facing a critical shortage of protective equipment, even for our healthcare workers. We do know that if an individual is sick and they are wearing a mask, they prevent some of the spread that could happen for them infecting other people. And so certainly if you are ill and you have to go out, it would definitely be preferred for you to wear a mask in that situation. In terms of asymptomatic people, there's no recommendation to do that right now, but there's a lot of chatter on the national level, and you may have even heard some of it, about will the CDC eventually recommend people in general wearing masks if they have to make critical trips. You know, I think one of the challenges to that is that even our healthcare workers are still currently short on protective equipment. And do we really want to use masks that could then impact our hospitals from being able to get those supplies to actually take care of known COVID positive patients? So I think that that's a challenge that there's not a real clear answer to at the moment. I would definitely say this is another reason to only go out if you absolutely and critically have to. Don't make a joy ride or a joy trip, and definitely don't make a joy ride or a joy trip and wear a mask, because that's taking a mask away from a healthcare provider that could really need it to take care of a critical patient.
And some people have asked about Cameron Parish people who have Calcasieu Parish addresses being reflected in the Calcasieu numbers. I don't know.
Dr. Kavanaugh, I think the gist of this question is there's maybe information out there that Cameron Parish residents might be included in Calcasieu numbers.
Because they have a Calcasieu.
Because they have a Calcasieu address. I don't know if you know the answer to that one.
So I know it's the data is being collected based on address. So if it's a Calcasieu Parish address, then it will probably be counted at Calcasieu. Don't let the numbers fool you. As you've probably heard the governor and many others say in the past couple of days or weeks, even if you see a 0 for a parish, don't believe that, because I can guarantee you that COVID is everywhere. And so yeah, but there are sometimes some challenges when it comes to reporting out of that data, because it is reported based on address, and there definitely is sometimes gray zone.
Dr. Kavanaugh, this is a question from me that is it possible in those low areas or even some with 0 that they just aren't conducting tests there?
Oh, absolutely. If there's no access for people who live in a place to get tested, well, then you're not going to have any positives show up on the map. So I do think that the numbers that you see in different places are partially related to the number of tests that are being conducted in those areas, and also relative to the size of the population in those areas.
Good. Is that it for now? Okay. Thank you. We're going to go. Our next few speakers are elected officials. I know I say this each time, but it's very important for the public to understand how closely your elected officials work together. Our executive policy group is the police jury president, the 6 mayors of the 6 municipalities in the parish, and the sheriff. School board joins us very regularly as well through Carl Brookhouse. We had a conference call earlier this week. We are honoring the distancing as well, but it was very helpful, and we want to hear a few remarks from those officials, and we'll start with President Tony Gilry from the police jury.
Thank you, Brian. I want to start mine a little bit different because this has come to me in prayer, And I just want to say, dear God, please give us the endurance to continue ahead. Please guide our thoughts, words, and action, and that this time of social distancing and isolation will not last forever and will give us the strength to make it through this season. Amen. We're asking everyone to do their part in fighting this virus. Large gatherings now will result in more cases over time and make us stay home longer. That will make us stay home longer. Large gatherings are not worth the life of a family member, a friend, a member of this great community. We all are in this together. We all can make a difference. Again, stay home, stay safe, save lives. Thank you. Thank you, Brian.
Our next speaker is going to be Mayor Nick Hunter of Lake Charles, and as the mayor's coming up, he's going to have to leave in a bit, so after his talk, if you have any questions of him, it would be a good time to ask.
Thank you, Brian. Good afternoon, everyone. Ladies and gentlemen, Lake Charles and Southwest Louisiana continues to take this very seriously. I had a chance to speak with Dr. Manley Jordan the other day, the CMO of Lake Charles Memorial Hospital, and I found what he said very poignant. He said, if you haven't believed in this yet, the time to get religion is now. And I think that's very true. We've seen numbers increase, and we believe that those numbers are going to continue to increase. What we're hearing from the medical community is that the next 2 to 3 weeks is an absolutely critical and crucial time for Lake Charles and Southwest Louisiana. This is a medical and health emergency. Why would you not listen to doctors at this point in time? There are dozens of doctors on a national level, but I can tell you that even locally, I have spoken with over a dozen doctors over the last couple weeks, and every one of those doctors has said the same thing. Take this seriously and stay home. It is that serious. At this juncture, we have local doctors, law enforcement, local, state, federal officials that are asking people to stay home unless it is an absolute emergency. We continue to receive daily updates from our medical community. That line of communication is strong, and it will always be strong throughout this event. I want to take a moment to talk to the economic recovery. Obviously, the most important and immediate need and concern is the health and safety and welfare of our citizens. But there's a lot of employees and employers out there that are hurting. So I'd like to take a few moments just to recap a few things that are within the CARES Act that is so important for Southwest Louisiana. There are resources out there. We want to connect people to those resources. The CARES Act has something for everyone, every business or individual that's been negatively affected by COVID-19. The Paycheck Protection Program, the SBA Express Loan Program, the Economic Injury Disaster Loan, the Louisiana Loan Portfolio Guarantee Program. To find out more about these vital tools, number one is visit your banker or your credit union. Even if you're at a point right now where you're not hurting, visit with your banker or your credit union. You can find out more at allianceswla.org/inthistogether. And one of the reasons that we're trying to promote this so vigorously is that there are limited funds in some of these pools. Southwest Louisiana has been affected by COVID-19, and we want to make sure that locals access those resources while they are still available. Thank you. Any questions?
What if any stores or businesses are open that shouldn't be in? What if anything is being done to enforce the stay at home?
We continue to support the governor's executive order and are abiding by the spirit of that order. If anyone believes that there is a business that's non-essential that's open, they should report that from the city's standpoint to the mayor's action line. That's mal@cityoflc.us.
What will be done to enforce that?
We will absolutely make contact with that business, and we will make sure that they understand the spirit of the governor's executive order and take steps to comply with it.
A lot of people are upset. They drive by a big box store and there are cars throughout the parking lot, and they feel that people are not adhering to it, that they're going in there for recreation or whatever. What, if anything, can be done about that?
Well, again, we're having those conversations with those businesses. It is really on a case-by-case basis, depending on the business. If someone does feel that a business is not abiding by the executive order of the governor, again, they should email mal@cityoflc.us. We will make contact with that business. We have already begun that process, and we are seeing some results.
Some people want a curfew, many people don't. What do you think about that, a curfew in this area?
I'll probably defer to Sheriff Mancuso on that. I don't want to speak out of turn, but I venture to say he and I probably agree that at this moment a curfew is not necessary. In fact, what a curfew does is probably consolidates more people into a short amount of time, which is a bit of the opposite of what we're encouraging right now.
What, if anything, do you think about whether the number of people in stores should be limited?
Again, we're abiding by the governor's executive order, and if we find that businesses are unable to live by the spirit of that order, there are some other steps we can take. But we're trying right now to work with those businesses, and again, we encourage people, if they see things that concern them, email the mayor's action line.
What are you doing to take care of Lake Charles City employees and make sure they're not exposed to them?
Sure. Well, I can tell you that we have N95 masks available. We have stepped up our sanitation efforts and cleanliness efforts throughout the city, both with transit and at city locations. City Hall and our facilities are actually probably cleaner now than they have ever been in the history of the city because of the multitude of cleanings throughout the day. And we are taking every precaution available to us and abiding by the CDC guidelines. Thank you, Teresa.
Thank you, Mayor. Very helpful. And let me say it also at the parish, and I know the remaining cities, similar guidelines, making sure, first of all, greatly reduce staff levels, I know at our governing bodies, to try to honor the protections. Key services still provided, but there are, for anybody who does come in, we have temperature checks, a lot of cleaning, and again, I know because we've talked to all of them, all the cities are doing the same in the parish, school board, and others. Feel very good about that. We wanted to have the mayor of Sulphur speak today. Mike Danae was gracious enough to come. We appreciate coming over here, and he's going to give us a few comments.
Thank you, Brian. I just kind of want to reiterate what some of the speakers have spoken about is about if you have to, stay at home. Please stay at home. I cannot emphasize that enough. If you do have to go out, limit your trips out. Do what you have to do. Get back to your home as soon as possible. In those trips that you do take, please practice social distancing. By all means, you certainly don't want to endanger yourself or anybody else for that matter. For our business community, we hope that you would adhere to some of the CDC guidelines for businesses, making sure that your patrons practice social distancing for their safety, but not only their safety, but the safety of your workers just as well. With that, I'll be able to happy to answer any questions. Thank you.
Thank you, Mayor Danahay. I also want to mention, I know this has been asked sometimes, the West Calcam Hospital is a testing site as well at the hospital. It's not, the Burton Coliseum is key for that, but there are others, and I want to make sure people know about those as well. I'd like to go back to a previous question. Mayor Hunter alluded to this on the businesses. You've got two different issues here. One, is it an essential business, which there are federal guidelines very clear on that. The other group, which I want to refer to, is ones that are no question they're essential, but are they following the guidelines Mayor Danahay referred to? What we've done is already, we are starting to contact those companies directly because there are certain ones, some of the big box stores and all, we're getting more of the questions on. We're already reaching out, and even as of today, Target Corporation has put out some guidelines for all of its stores. It's going to start following. We really want to see more of that, but we're not going to leave it to chance. We want to find out what they are doing, and if we find that they maybe aren't putting in place, we will encourage them to do so. And I want to just state that. I know in just a moment, matter of fact, it's a good segue now. We have remotely Sheriff Mancuso, who will give us a few comments. So Tony, you can go ahead.
Thank you, Brian. Yeah, let me start off about crime and where we're at right now. Again, it's pretty quiet. All the chiefs, we communicate much daily, and our criminal activity is still very, very low, which is a good thing for us. The less contact, of course, with people, the better we are for our safety. The only really increase, which is expected, was in our domestic calls. And it hasn't been a significant jump, but it has been a little bit of a jump. So we're going to deal with that, and we're going to continue monitoring our criminal activity. But I'm very pleased that it is low, and it's been pretty quiet from all around. When you talk to all the neighbors and all the sheriffs, the chiefs, they all feel the same way, that our call volume is down, our reports are down, our thefts are down, everything but some of our domestic calls. With that said, I do think, I have gotten a few calls, not a lot, about some of the excess in some of our big chain stores and what's going on in those. And I think we as a group are addressing that. There's really no specific law that covers that. So this is more of a voluntary issue, and we really need people. I think that's what we've been asking, and I think Dr. Kavanaugh explains it very well. Our numbers are not spiking a great deal because we have been social distancing. But if you go out there and you look, we're still not doing totally what we should do. When we go into these stores and we bring, 5 family members with us, that's not exactly social distancing. So we've got to do a better job. And look, I know everybody's getting tired. They're getting anxious. I get that. I think we all, by this point, get that. Trust me. But this is our duty right now. If you want to help and you want to be a part of the solution, then everybody has to just kind of take a deep breath, relax. And again, I've said it, I'm the eternal optimist. I do know that everything's going to be okay. There's no question we're going to come out of this. We're going to be just fine. But there's some people that are not going to be fine. They're very, very ill, and we've had a death and probably a couple more. So we need to do more as a community. If we love each other and we care about each other as a community, then we will do more. That means when you go into a store, look, I can tell you an exact story of an elderly gentleman that I saw, and he came up to shake my hand, and I backed off and listened. That's so out of my character. And he said, wow, that's the first time I've ever gone up to you, and you didn't want to shake my hand. I said, well, we've got to practice this social distancing, and until we get back to a normal, we're going to all have to do that. And that means everywhere you go. It doesn't matter if the grocery store or the Lowe's, and I don't want to pick on a particular store, but our big chains that are exempt from the numbers, that doesn't mean that we need to be gathered and congregated and in big clusters at these facilities. We as a community have to do a better job and make sure we're doing our social distancing ourselves. We don't need the police or anybody to tell us how to do that. We know how to do that. So we just need to do a little bit better job. We're doing a good job, but unfortunately, good's not going to be really good enough for this. We need to be on the top of our game. We need to bring our A game right now. It's important. I think we could see an end if we do this. If we just tighten our belt buckle and we all do our part, we're going to get to the end of this, and it's going to be more positive than negative if we do it the right way. And that is by listening to it. Look, I can promise you this is way out of my wheelhouse. I'm not a doctor. I'm not a medical personnel. But I can tell you I trust the people. I trust Dr. Kavanaugh. I trust Dr. Jordan and the other doctors that we have listened to. I trust them with my life right now, and so should you. The social media rumors, again, I hope that people will just block that out and quit listening to that and listen to your public officials. One of the things that they said the other day is, our public officials are lying to us. They're not telling us everything. Let me tell you, I promise you, we're not exaggerating it and we're not sugarcoating it. We are telling you exactly what we're hearing and exactly what our medical professionals want us to do. And that's what we're pleading and begging you to do. So with that, I'll take questions, and God bless everybody. And I hope everybody understands that this is a situation where really and truly your life depends on it, your neighbor's life, your grandchildren, your parents. We all have to take this very seriously. But it's a very easy concept if we will follow it.
Thank you, Sheriff. I do believe we have a question or two.
What's being done to keep the jailers and the inmates protected, and have any of either of those groups tested positive?
Okay, she asks, what is being done to protect the jailers and the inmates regarding the virus, and what was
Have any tested positive?
and have any tested positive?
Or is there any testing going on?
We are doing testing. We monitor all of our employees every day and all of the inmates every day. Of course, you know, we have a medical staff at the facility, and we have not had any inmates that have tested positive or that we've had to test at this point. We have had some deputies, but they were not in the facility when we figured out that they were having symptoms. In other words, we're very, very cautious about if they don't feel good and they have any symptoms. They don't have to have two of them or a multitude of them. We check their temperatures. If they don't feel good, then we are sending them to a private lab to get tested automatically. If they come back positive, we've had, Teresa, I think 7. They're not. I can't give you the numbers right now. Whether it's 2 correctional officers and 3 patrolmen, and 2. I don't know the exact numbers, but we are getting them tested. We are taking all the precautions that we can to protect them. We've done like most of the agencies, and our patrolmen and our corrections officers. We have no choice but to be out there, kind of like the doctors. So running away or leaving is not an option for us. So we're just taking the next steps and precautions for our safety, which is to monitor each other very closely by taking temperatures. If we even think somebody feels bad or is not doing good, then we send them for testing. If they test positive, we've had, like I said, I think 7, and we have 900 and something employees. They are quarantined, and they cannot come back to work until they've met their 14 days and test negative 2 times for 2 more tests. So I don't know if that answered totally your question, but yes, and no inmates so far have contracted the virus, COVID virus.
Let me add to that, Teresa. I appreciate the sheriff mentioning that. I don't know if many people realize this. Under Louisiana law, parishes working along with sheriffs are responsible for medical care out at jails. Parish actually owns the correctional center, but it's a combination. In both of us, there are a lot of nurses working out there, plus we have a nurse practitioner. And those folks, I know the healthcare providers, all the people out there are just doing so much for us. I don't want to forget those out at places like the correctional center. I don't think people maybe realize they're even there. They are working tirelessly. And it's a big demand, frankly. And it's not, you can imagine, it's not the easiest thing to keep staff. So I appreciate the sheriff mentioning that. A lot of good work going on out there to try to keep everything from getting worse.
And I might.
Oh, I'm sorry.
Go ahead, Tony.
Go ahead.
I was going to say, and I might add, Jeff Clark, who is the police jury's nurse practitioner nurse that heads up our facility. We have come up with a comprehensive plan. Again, we started this when this, several weeks ago, before it even got to any crisis as bad as it is now. We have a plan to segregate our population if we have to. We have a plan that when they come in, how we treat them, how we test them, how we deal with them. So he has put together a really comprehensive plan. And again, so far, we have not had a case. So I again, like Brian said, I have to commend them. They're doing a wonderful job. So, and our supervisors at the sheriff's office are doing a wonderful job. They're monitoring their own employees. We've invested in, I don't know how many thermometers, but everybody gets checked when they come to work. I mean, we're doing our part. We're social distancing. We split up shifts like detectives. Or some are working evenings, some are working days. They're not allowed to get close to each other. Our homicide detectives come in one door. They cannot go through another office. Our crime detectives, our sex crime detectives go through another door. I mean, when I tell you we have taken this seriously and segregated our population as best we can, we are doing that. So, again, we don't have the option of just closing down, and we have a job to do, and that's to keep our community safe, and we are going to do that. And but the people now just need to do their part and do the best they can to do a little bit better to social distance themselves.
Okay, I think we have another question.
A lady wanted to know
Sure.
if anything could be done to get the juveniles under control. She didn't want to call the police on them because she was afraid it might make things worse, but she feels they're out of control and wreaking havoc on the older people.
So one of the viewers is stating a concern about juveniles in the community. I'm going to use her phrasing, not mine, that they're out of control.
Well,
I'll let you
again,
address that, Sheriff.
I have not had any calls out of the ordinary. Our call volume is not up. They're going to have to call the sheriff's office if they feel like there are people that are causing disturbances, just like they would do any other time. And we'll go out there and we'll investigate and determine, what we should do about that. So, to my knowledge, again, I don't know of any problems like that. Again, our call volume is down, and we have not noticed an increase. I know that the police jury and ourselves, they run the juvenile detention center with the Mark Center. We've adjusted hours there to accommodate if we had any problems, and we haven't. So I don't really know where that's coming from, but I certainly would address it if we have a problem and we need to.
And I can go ahead.
Curfew a minute. I know curfew was a question. I'm going to say it again. I'm going to stick by it. I know the mayor kind of touched on it, and we are on the same page, and all the chiefs are on the same page. We just don't see any need. There's no dangers lurking on our roadways. That's not where the danger is in your car driving or things like that. So, when we do a curfew, it's because there's debris in the street, or there's there's no lights and no electricity, which means our burglar alarms don't work and our camera systems don't work as good. So this is a whole different type of disaster that we, frankly, just as a group, don't believe that a curfew is warranted. And why would we do something just to do it to say we can? We just don't believe that's warranted at this point.
Very good, Sheriff. Thank you. The sheriff was our last speaker on the roster today, and we've gone through some question and answers. We, at this time, do not have another public briefing scheduled. However, we will make sure we have at least one before next week is out. If necessary, we will do that prior, and certainly with plenty of public notice when that's scheduled. But at this time, I think we're wrapping up, but we have one more question.
We are still getting calls from people, whether they work at a grocery store or a nursing home or whatever, who do not feel safe. What should someone do if they do not feel safe at their workplace?
I believe the mayor stated this, and probably the sheriff, but the key, of course, is, and we can direct them to that, is it's very important to try to speak with that facility or that company's management. Other than that, any thing where you're not sure, you certainly can call, depending on where it is, the city or the parish. We can get it to the right people, but we need to know specific information to do anything with it. And depending on the nature of the concern or the complaint, Teresa, I think you can't answer too much until you know more of that. But certainly any general questions or concerns from anybody at a particular site, just report it to that local government, or if it's a health concern, I think the public health office, they want to hear about these if they think there's some threat of an outbreak for some reason, for an example. They certainly are there for those as well, but it probably just depends on the person or the complaint.
Okay, thank you.
Thank you, everybody, and we will announce the next public briefing once it is scheduled. Thank you.